we focus on the people that think they can't be helped, right? I mean, we really, we don't need to do decompression on people that will get better with chiropractic care.
Correct. I agree with
We
you on
don't need
that.
to do decompression on people that need to just go out and get some exercise and go do some yoga classes. There's no
Yeah.
reason to do that. We've developed this reputation for helping people that can't be helped or that have failed everything else. They've failed chiropractic, they've failed physical therapy, they've failed acupuncture, they've had injections and they're tired of putting steroids into their spine. So
Hmm.
we look for the people that really have failed, and then we look and see if they're a good candidate for decompression.
Oh, hello, everybody. It's Dr. Troy here from Everything Disc, from pain to play. I am excited about today's episode. I got my good friend and colleague here, Mr. Harry Engel from Lancaster, California, Antelope Valley area. I'm excited that he decided to come on the show with us today, and we're going to discuss everything disc and maybe some other things too. But we got a great show ready for you guys today. Um, I've known Harry for probably 30 years. I know you've been in practice 34 years. You are one of the early innovators in spinal decompression. You've seen thousands of disc cases in your career. You've consulted with doctors. You've run successful clinics. I mean, you've pretty much done A to Z and everything in between. So it's really cool to know you, and we've collaborated on a lot of things together. So I just want to welcome you to the show today, and I'm excited that you took time out of your busy schedule to talk to our listeners.
Great. Looking forward to it, Troy. It's been a long journey you and I have been on, and I remember the early days when you were looking at starting decompression in your clinic, and you and I were doing research and looking at who was in your community doing it, and really what kind of results they were having, and figuring out how you could implement it within your clinic. And man, you've done exceptionally well with it. You've got a heck of a reputation in the Northwest for being one of the top clinics. And I think, as you'll discover later on in this conversation, it's more than just the technology; it's the skill set that goes along with it. And that's pretty cool to see you in action and see the kind of results you get.
Yeah, and I appreciate that, because, I always thought that all doctors, were worked as hard as we did. I thought that was just normally what we did. But, you know, I think you and I both have this passion to really help people, get their life and their health back. As 80% of the American populations in the world are suffering from back pain at any given time. So that means 8 out of 10 people have some sort of spine condition. And, in my experience, and, being president of the International Disc Education Association, we say that all roads lead to a disc problem. And I had an earlier show with a doctor, and he said his youngest case was 12 years old. And I'm certain these disc conditions start even earlier than that. But that was what he'd experienced as the youngest case. But then, as we mature in life, we get older, the spine tends to break down, especially if we've had trauma and stressors and we're not taking care of ourselves. And then we wake up one day and we're like faced with this back pain issue. And a lot of people don't know what to do. That's why I like to do these podcasts, to get other doctors' perspectives on what else is out there besides the traditional medication and the surgical route. And, at times I say those may be necessary, but the technology that we have been using in our clinics help anywhere from, the research shows anywhere from 80 to the mid 90% success rate when, 60% of back surgeries, first ones fail, and the failure rate goes up even higher than that. Harry, can you talk a little bit about spinal disc issues, stenosis, degenerative discs, and kind of talk about what you see in your clinic and how you're helping these people?
Well, so super cool. First of all, not a doctor. I'm married to one, and a little bit about our story. We have had a chiropractic clinic. We still do. And my wife, Dr. Fry, went out on maternity leave, and all of a sudden we had doctors covering for us. And my wife's a spectacular chiropractor, but we found that we weren't getting the same results with our doctors that were helping out while Dr. Fry was on maternity leave. And so, a friend of mine, now dead, but a hell of a good guy out of New Jersey, Ed Cohen, said, "Harry, man, you need to check out this DRX 9000." And so I flew out to New Jersey and I looked at his machine and I thought, wow, this is pretty cool. and we just bought one. And at that time, yeah, I think we spent about $120,000 on our first DRX 9000. Pretty soon we had three of them, and that was well over 20 years ago. We were one of the
Yeah.
first in California to be using the DRX 9000s, and we've been running them ever since. This piece about young kids and disc issues, it's becoming more prevalent,
Mhm.
primarily because of the this what we call forward head posture
Yeah.
is changing the curves on the neck. And when you start to change the curves on the neck, you're going to start to have disc pressure. We also see kids that have really hurt themselves in athletics. Hitting the soccer balls caused some issues and driven in some patients with disc problems, and football for sure.
Yeah.
And so we've seen it, in sports, everything from kids in high school to professional athletes, professional football players, professional hockey players, believe it or not, and professional baseball players have all come in. But I think the athletes we see the most complaining of disc problems that we know are athletes are golfers. And that's
Yeah.
because that's
See it
because
all the time.
those people do this thing called torque the heck out of your spine. And then whatever else happens, the recoil and everything else, it's just really hard on the disc, providing a set of wear and tear where degeneration kicks in at an early age. I'd say a substantial part of our maintenance patients are golfers, and they don't miss their appointments ever
No,
because
no.
they know that when they get decompression, that their golf swings better and their scores better, and that's all that really matters in life. And we have people that
Yeah.
drive an hour for their maintenance appointments just because they want to come to our clinic. We use the DRX 9000s because we think they're spectacular machines, and our staff is so good at what they do. They're able to identify people that may be slow progressors or potentially patients that may need an alternative way of addressing the disc. And so our staff really makes a huge difference. And we've been focusing ever since we got our first DRX. How do we get from that 80%, 8 out of 10 patients get better, to 8.5 out of 10, or 9 out of 10, or nine and a
Yeah.
half? What do we have to do to make a difference with that little percentage of the population? And
Yeah.
so we keep buying technology and testing technology and integrating technology. And we've created this thing called a technology stack. And we've got a
Yeah.
flow chart.
Yeah. Yeah.
And so the way the technology stack works is, hey, you're on decompression, you're doing great. Okay, you're good. We might give you some supplements. We like the cheap stuff because there's no sense paying a ton of money for supplements if you don't have to. And
Yeah.
one of our favorite starters that works for a lot of people just to help with inflammation, and thing called Formula 303 made by DC Labs.
Yeah.
Low cost, works easy, smells horrible.
Valerian root. Yeah.
And then when we start to see patients not recovering, then we kind of go through this decision tree that helps build a new stack for them.
Hmm.
We look at perhaps we're at a wrong level. Sometimes an MRI might show you've got a disc at L4, L5, but the pain's really coming from L3.
Yeah.
And so, even though you've got a disc, that's not the source of the pain. And there are other variabilities too in terms of people's height and weight and all those sorts of things that really encourage us to look at disc levels higher and disc levels lower and identify really what it's going to take to get the distraction at the exact location. Then the
Yeah.
then we have other things that we do as well, other technology that we've integrated. We're fans of this device called a Hacomed,
Hmm.
which is it's a very, very, very expensive electrical stimulation device, um, and we can deliver a nerve block with it to kill pain. And sometimes we do
Electrical.
that.
Electrical,
Yeah,
not chemical.
yeah,
Yeah.
electrical. Yeah, and that allows us to perhaps get in some deep decompression that we normally would not be able to do because the patient would be in too much tension.
Yeah.
Too much spasm. So that's technically our first step, is to see if we can break pain cycles to allow the decompression to get in and work. And again, this is on the 20% of the people or the 15 or the 10% that aren't really responding as quickly as we'd
Yeah.
want them to. And so we have a number of items within our technical stack that we look at. How do we get this person to feel better? Sometimes we find that we're better off if we get them prone.
Yeah.
And that requires using
Face
a
down.
different. Yeah, yeah, and that requires using a different, decompression machine that we love. It's not our primary decompression, but it's our, "Hey, this is for patients that are failing within the primary model."
Yeah. Yeah. Well, you got lots of tools in your tool bag, sounds like.
Yeah, we sure do. And most recently we've added, and we're super thrilled about it because we're getting amazing results where perhaps in the past we might have got stuck. And what's just for what it's worth, what gotten stuck means to us is that somebody we'd planned on a 20 visit care plan and we had to go to 35 to actually finally break through, right?
Right. Yeah. Yeah.
So this new device, it's called Hydrowave. It's made in Canada by this chiropractor, Dr. Mark, who's just a genius, true genius, technologically and a great chiropractor as well, and turned out to have become a really good friend. And this Hydrowave machine is a form of shockwave, but it's really, really deeply penetrating. And we've just seen spectacular results where people are just stuck, and it helps us break up some of the adhesions. Or I don't know what the magic is. I just know that we
It
apply
works.
it, and all of a sudden somebody's starting
Yeah.
to feel better, and we're starting to move again. And it may only
Yeah.
require a course of 4 or 5 or 6 sessions or whatever it is, but it opens up things so that the decompression can work again. We have this technology stack that we use, and it requires 2 things. It requires doctors that are in tune with what's going on with their patient, but more importantly, it requires a team members that are actually keenly aware of what's happening. Because frequently people will look at a thing like a pain scale. Well, what's your pain level today? My pain's an 8 out of 10. Well, what's your pain level today? It's a 6 out of 10. Really? Is there any difference between a 6 or an 8? Not in my book, right?
Right. Right.
That's moderate
Yeah.
to severe, right?
Yeah.
Moderate,
Yeah.
right?
Oh, yeah. They're still hurting.
So you've got to really be asking different questions. I mean, probably the most common thing that they catch is patients coming in on Monday saying, "Hey, this isn't working." And I know you've never had that, right?
Oh, yeah. Have it
This
happen
is
all the
not
time.
working. And then you say, "Well, you were really doing well on Friday."
Yeah. Love it. Yep.
And then they'll say, "Oh, yeah, I played at 36 rounds of golf," or, "I walked them all," or, "I went to
Painted the
Disneyland."
fence,
When
polished the
was the last time
cars.
you did that? "Oh, the last time I did that was 10 years ago." Okay,
Yeah.
well, thanks for not following instructions, buddy.
Yeah.
So,
Self-induced conflict there.
yeah, so, our staff is really, really good about understanding what's going on and getting into the nuances that really help us have a substantially better track record, in ever increasing results.
Yeah, that's interesting, I had a guy that came into me, he started on a Monday, it was like a 9 out of 10, and on Friday, he's a 1 out of 10, and he comes in Monday all upset, he's a 7 out of 10 again, and he's like, "This isn't working." I go, "Well, hold on, what did you do?" And basically did everything he couldn't do, and he was a 9 out of 10. So, you get the story. But Harry, what types of what kind of limitations do you see people come in with? For me in my office, usually people they're having trouble sleeping, they're not sleeping good. And that's probably the biggest thing I see people pick up the phone. They're like, "Oh, my back hurts, no big deal. I can still walk the mall." But now I'm having trouble sleeping. So now I'm picking up the phone and coming in. What kind of things do you see that really motivate people to come in?
Well, for sure, we focus on the people that think they can't be helped, right? I mean, we really, we don't need to do decompression on people that will get better with chiropractic care.
Correct. Yeah. Yeah, I agree with
We
you on
don't need
that.
to do decompression on people that need to just go out and get some exercise and go do some yoga classes and all of that. There's no
Yeah.
reason to do that. We've developed this reputation for helping people that can't be helped or that have failed everything else. They've failed chiropractic, they've failed physical therapy, they've failed acupuncture, they've had injections and they're tired of putting steroids into their spine. So
Hmm.
we look for the people that really have failed, and then we look and see if they're a good candidate for decompression.
Yeah.
So if they really haven't done this other stuff, sometimes we go, "Hey, look, let's try a few things first before we come in with a heavy duty kind of a decompression program."
Yeah.
Because that's a big commitment on our part. We're taking a patient on like we're going to get you better. We're going to do everything in our power to do that. And it's a whole team approach. Recently, we've seen just a ton of athletes wanting to perform better or wanting to
Hmm.
get back in the game. But we
Yeah.
also see a lot of people coming in wheelchairs. Had a guy a couple of months ago who came in, could not stand up straight, bent over in extreme pain, like just spasming everywhere, couldn't sit, couldn't stand, couldn't lay down, couldn't do anything.
Mm.
And I said to the doctor who was managing his case, Dr. Joey, and we were talking about him, and Joey goes, "Man, this guy is really, really having a tough time." And I said, well, let's see what you can do with him. And when I saw him in the office every once in a while, I'd go over and say hi to him. And pretty soon he was smiling a little bit.
Yeah.
He said, hey, I slept a little bit. I slept a little
Yeah.
bit last night, right? Pretty soon he was walking in without a stick. And this guy drives probably somewhere in the area of 5,000 miles a month.
Hmm.
He's got a
Lots of
large route.
sitting.
He's got a large, yeah, and, sitting is just not conducive, and so we've gotten him better, and he's now driving his 5,000 miles, and, he's coming in for maintenance because he knows he's jacking up his back every month, but he's pain-free, happy as all get out, and, yeah, so we see a lot of people like that. They'll come in wheelchairs.
Yeah. It-
I'll tell you the ones that we have the hardest time with. It doesn't mean we fail, but we have the hardest time with people that have a gut. And if they've got a gut, two things are happening. One is they're carrying extra weight on their
mhm,
spine, which is
mhm.
which is counterproductive. And the other thing that's happening is they're putting a force forward, which is changing the structure of the spine, and it's putting pressure on the backside of the spine, which is pinching nerves and doing all these things that make people miserable.
Yeah.
And so for some of those patients, we're like, we hate to tell you this, but you got to lose your gut. You got two choices. You can come in here and do decompression every week for the rest of your life or whatever will help keep you out of pain, or every twice a month or whatever that number is. Or you can begin to take care of yourself so you're not torturing your spine like this.
Yeah.
And we help them lose weight. It's not that hard to do.
Yeah, that's a good thing. I noticed that too. People, they put this extra stress on their spine, and then usually the lower lumbar, that's what takes all the punishment. So typically when you see somebody come in the office, are they coming in with low back or neck, or do you see this disc thing tend to be systemic in your clinic?
Well, for sure, we see the least amount of thoracic. And
Mid
going back to
back.
that, yeah, yeah. And going back to your technology stack, there's a way to access the lower mid back region and the upper mid back region, but that central mid back region is pretty hard to get with most decompression devices.
Yeah.
So we do use one other tool in our office for those patients quite successfully, actually. Something you introduced us to, which is the Cox table. And using the Cox technique because we're actually able to manually get in there and begin to open things up.
Yeah. And it's
So
gentle. It's a gentle technique.
it's soft and it's slow and it's easy and it's safe.
Yeah.
Everything we do is safe. Our issues we cause are just so rare, so rare.
Yeah, especially with the
And even
technology
when they
we're
do
using.
happen, they're probably not a result of something that we did, right? I mean, it's unheard of. But we see more lumbar spine. It's probably low back to neck is probably 3 to 1.
3 to 1. Yeah.
Yeah.
Yeah. Ours is probably 60/40 in our clinic.
We actually see a number of people coming to us after they've been in a car accident. And what's interesting about that is they may have treated with other clinics for their car accident, and they may or may not have settled their case. They've gone to pain management. They don't want to do the injections because they know the injections aren't good for them and they're just temporary. They're a band-aid that covers up the problem, and you're still causing the problem with what you've got going on. So you're still irritating the nerve. You just put a painkiller.
Right. Right.
And so we see a lot of people who have been in car accidents. They may have treated with other doctors and they come to us, and some of them pay cash. Some of them ask us if we can work with their attorney on it, but they usually respond really, really well.
Hmm.
Some of them have ligament laxity, which makes
Yeah.
it much more complex to manage.
Well, that accelerates the breakdown too of the spine and the discs and the
Sure.
ligaments and
Sure. And our Dr. Ted is probably one of the most experienced guys you'll ever come across in terms of dealing with ligament laxity. I mean, just a profound amount of experience, and frankly, one of the most experienced chiropractors you'll ever come across. My suspicion is he's probably delivered somewhere in the area of 500,000 adjustments in his career, maybe more. I mean, he's just
yeah.
really, really good.
That's why I
And
tell
he's
people find someone who's been around a while.
Yeah, and he's been running our decompression program for at least a decade. And he's done a lot of work with people in auto accidents and is really an expert at ligament laxity as well. So, when people come in and they've been in a car accident, they're really lucky that they that they get to see Dr. Ted as opposed to some guy fresh out of school, or
Right.
somebody who doesn't
Yeah.
know what they're talking about.
Yeah.
You got to
Yeah.
take
So
specialized X-rays, right?
yeah, the motion X-rays, you're doing those as well.
Yeah, you gotta take specialized X-rays
Yes.
that actually can show the ligament laxity, and you really gotta look at it from lateral as well as A to P, in other words, front to back and side to side,
And motion. Yeah.
to
Throw
see those.
motion in there too.
Yeah.
I see a lot of people that go to the hospital have X-rays. I'm like, I want to take my own because a lot of the structural things that we look for as landmarks, they're not there, or they don't test the integrity of the spine strength. So you can miss these laxities in ligaments, which lead to chronic joint problems and disc problems, and lead to chronic disability long term.
Yeah, so this is a key thing related to our success, in that when somebody comes in with an MRI that's on a sheet of paper, we thank them very much, and we say, "I tell you what, we'll go through, and we're actually gonna take a fresh set of X-rays today because we wanna see what's going on right now.
Yeah.
And we'd like you to go get the disc, or maybe we have access to it online and we can actually log in and look at the MRIs online, because we've learned not to trust MRI reports.
Yes. Yes.
There's there's a couple of issues. One is there are elements frequently missed. Secondly, we want to be able to actually correlate where the pain's coming from and what's actually happening, and look at these. So our doctors, we read our own MRIs. We read MRIs ordered by other doctors as well. And it's just it's an integral part of our ability to really understand what's going on, because we can now visualize it because we can see a picture rather than words on paper. And we can
Hmm.
actually see what's going on and go, well, that 2 millimeters that it says in the report sure as heck looks like a heck of a lot more, or it
Yeah.
doesn't look that good over here, or it's correlated with a desiccation or degeneration that they don't really talk about on the MRI, or there's an overhang over here. What the heck's going on with that? And so
Yeah.
there's a lot that we can see when we look at the pictures. And so we always look at the MRIs ourselves. And it helps us because we don't want to bring somebody into our program that we don't think we're going to be able to fix.
Right. Exactly. Yeah.
So it makes a huge difference in isolating patients that we know we can help, or patients that we go, hey, look, this is going to be a crapshoot. You got a lot of stuff going on here. It's going to take a lot of work. This is not going to be easy.
Yeah.
Or, we don't think this is going to work. You might want to consider getting surgery, or you might
Yeah.
want to consider something else, or whatever it might be.
Yeah. Yeah, but so you've been doing this what, almost, well, 35 years, and decompression for the last 20. And so what would you say to somebody who's suffering out there and maybe they've tried, the traditional chiropractic, acupuncture, physical therapy, they're looking at injections, or maybe even they've had spine surgery, It always boggles my mind that people spend 10, 15, 20 years trying to get relief, and then they show up at our office and expect to be out of pain in, 2 minutes. So what would you tell somebody who's been struggling and they're skeptical, and what would you tell them?
Well, this is your personal battle. This is your battle. It's not the doctor's battle. It's not, this is your life. You're responsible for your outcome. Your insurance company is not responsible for your outcome. You get to live the rest of your life with the condition that you have and whatever changes you're able to make to it. And if you're going to look at decompression, and I would suggest that it's usually a pretty cheap thing to look at it,
Yeah.
you really want to find
Not only
somebody
cost wise, but health wise, long term function wise.
all the way around, right?
Yeah.
The risks are incredibly small, and the results are incredibly high in general. I mean, I just, Excite Medical, a company run by this guy, Sam, out of Florida. They've been working with the University of Florida, and two recent pieces of research on the DRX 9000 that have come out. And I know you've got those machines as well.
Yeah. Yeah.
That technology is really amazing. The one was published in Military something or other.
Yeah. The military.
Uh,
Yeah.
yeah,
Yeah. I just read that.
and it talked about significant decreases in pain level and in disability.
Improved
And
muscle strength.
yeah, so I mean, we're seeing this research coming out that's consistent. I mean, it's the first time I think research has come out in probably over for a decade. And then the second study they did was looking at MRIs pre and post, and showing an
Mhm.
increase in the size of the disc
Yeah. Yeah.
post. And so, the thing about this, I can make decompression really simple. If you were to go to the store and buy one of those sponges, the ones that you add water to and they kind of
Yeah.
open up, right?
Yeah. Yeah.
So basically what happens is you've got a vertebra here and you got a vertebra here. And then between it, you've got this disc, which is kind of
This
like a
disc, like
marshmallow,
this one right here,
like that one right
that
there.
blue,
Exactly.
that's the
Yep.
disc.
Yeah.
Yeah.
And so what happens is that disc gets its nutrition and gets rid of waste from the vertebra above and the vertebra
Yeah.
below. And it's kind of
Yep.
like squeezing a sponge, squeezing all the water out, which is getting rid of the waste product that's been occurring from the healing and whatever else and damaged cells. And then you release it and it sucks in the water again. And that brings in fresh nutrients. And this is how we can actually see the decompression work because of the algorithm that the computers within this technology use. It pushes these discs together with the muscles and it
Mhm.
pulls them apart with the decompression. And then so it does this motion back and forth like this,
Yeah,
which
it's kinda like milking a
squeezes.
cow.
Yeah, exactly. And so, well, not quite, but this is how they're able to actually show pre and post MRIs of increased disc size. And this was done at a university. This is done at a university research level.
Yeah.
So pretty exciting to see the stuff that we've known, and we've seen it with X-rays, and sometimes we actually pay for MRIs for our patients to do a follow up, but we usually don't care. We got the result, right? Patients
Yeah,
are
they
feeling
they just
better.
they
They're
just wanna
playing
feel
golf
better.
again, right? They're
Yeah.
picking up their grandkids. They're gardening. They're cooking. They're walking upstairs. They're driving. They're all those kinds of things. Life has come back.
Yeah, so you're getting them from pain to play.
Pain to play. You've been waiting for that all day, haven't you?
I just gotta throw it in there, everything disc, pain to play. So so Harry, I mean, that's a lot to unpack for our listeners, which is really good. I mean, we could probably spend all day talking about this stuff and sharing research. But for my story, I almost died playing golf and I was working myself to death because I just love taking care of patients. But I fell in love with golf and so every time I do a podcast, I always like to ask my guests, what's one thing you would tell a golfer with what you do? What would you tell a golfer that wants to improve their game or feel better?
Well, I would tell them to find a really solid chiropractor that adjusts with his hands and can keep your spine moving. Because if you do have a fixation and your spine is like not moving, but like this level's moving and these levels aren't, you're going to put a lot of extra trauma on that one level. So if you can get motion into all your spinal segments, it's the best place to start.
Yeah. Yeah.
And if you've got pain, consider that waiting for it to go away is not the smartest thing to do because the body has this thing called homeostasis and it
Hmm.
wants to just get back into this sort of balance level. But if you get into a balance level and you've got some fixations in your spine or some misalignments in your spine, you're just going to put wear and tear on it for the long term.
Yeah.
So don't ignore it. Chiropractic's cheap. I mean, you can go to some of these places that are cash and it's $35 an adjustment or $40 or $50 or $60 or
It's cheaper than a
who
round of
knows.
golf.
Yeah, and it'll keep you playing golf a lot longer.
Yeah.
And
Yeah.
if you've got pain that doesn't go away, then you really need to find somebody who is exceptionally good to deal with that.
Yeah. No, that's good. Good advice for people is, take care of your spine. It'll last longer and you'll play better. You'll perform better without pain. That's our whole goal at everything disc. So, Harry, I want to say thank you to you for taking time out of your busy schedule. I know you're busy taking care of patients and you're doing some consulting with other healthcare doctors. So, appreciate you and your work in that. And it's great having you as a colleague and friend for the last, 30 almost years here in our field of everything disc. So, Harry, I want to thank you for your time.
Troy, great seeing you. I'll see you in a month.
Okay, sounds good. I look forward to we'll fly down to Arizona and do our yearly annual training in Arizona. So, Harry, thanks again, and we'll put Harry's contact information there in Lancaster, Antelope Valley, if you want to reach out to Harry if you need anything. And thanks again, Harry. This is Dr. Troy. Everything disc from pain to play.